Mucormycosis, the black fungus that is maiming COVID patients in India. I've had a lot of people reach out to me over the past couple weeks because they're terrified of this new black fungus. Is it going to spread to the United States? Will this be the next big issue? People here getting black fungus. Well, let me break it down for you and help you understand exactly what is happening. But before we get started, be sure to subscribe to the channel and hit that notification bell. If you don't hit the notification bell, you'll never hear about my new videos. You always have to make sure that you are hitting these triggers to be alerted. We had a person recently ask if Dr. Zarowski does any videos anymore. And I'm sitting here doing like 5-6 videos a week, and they're like, is he even on the internet anymore? Well, you know what? It so happens to be that a lot of these big tech platforms don't want you to get natural health information. So be sure to hit that subscribe, the notification bell, and then to check out all my videos, go to www.drzee.tv. Remember, we have our own website. You can find all of our information there as well. Now, let's get into this article. I want to read the beginning of it here. On Saturday morning, Dr. Nair, a Mumbai-based eye surgeon, was waiting to operate on a 25-year-old woman who had recovered from a bout of COVID 3 weeks ago. Now, let's get a comprehension of how serious this really is, this black fungus issue. Inside the surgery, an ear, nose, and throat specialist was already at work on the patient, a diabetic, okay? Now, there's a lot of things to uncover there. First of all, we know that this fungus really attacks like the ear, nose, throat, sinuses, those areas. And then the other thing, it tends to be very opportunistic in diabetics, okay? Now, let me be clear too. It doesn't matter what it is, bacteria, virus, fungus, whatever it is opportunistic. That means that people who have a depressed immune system, it likes to go and attack them. That's simply what it means. I have been saying this from the very beginning of COVID because so many people don't understand that. If you have a well-functioning immune system, opportunistic bacteria, viruses, funguses can't really do a whole lot to you. Now, he had inserted a tube in her nose and was removing tissue infected with the mucormycosis, a rare but dangerous fungal infection. The aggressive infection affects the nose, eye, and sometimes the brain. After his colleague finished, Dr. Nair would carry out a 3-hour procedure to remove the patient's eye. Okay, so this is serious stuff. When somebody gets this black fungus, it is bad news. Literally, they're getting just parts of their bodies removed because it infects it, and it's just, there's no going back from it. I will be removing her eye to save her life, the doctor said. Even as a deadly second wave of COVID-19 ravages India, doctors are now reporting a rash of cases involving a rare infection, also called the black fungus. Now, this is pretty interesting, okay? Let's figure out what this black fungus is, because we know that it's a rare infection, and now we know as well that it's caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. Okay, so here's the thing about this, is that this is a more regional thing, okay? So people ask me all the time, is this gonna come to the United States? Is this gonna just start infecting a ton of people? The thing is this is a more regional problem, and the other thing is that it's not something that's just transferred from person to person, okay? You don't just walk across somebody on the street, they have black fungus, you get black fungus. That's not how it works. And the other thing that we have to understand about this too is that it's important to understand why it's happening, okay? Now, and let me say this as well. When anything like this happens in the very beginning, there's a lot of speculation. There's a lot of unknown. Like, how do you treat it? There's a lot of unknown. And even when COVID came around, that's when a lot of people just had no idea what they were talking about. Even the quote-unquote experts, you take guys like Dr. Fauci, he had no idea what he was talking about, right? I mean, how many times did he flip-flop on his position? And I had said from the very beginning, look, there's so much unknown about this, but the one thing we do know is it's opportunistic and it attacks people who are unhealthy. Get yourself healthy, boost your immune system up. That's why I put together immune system packets in order to help people boost their immune system. Just natural vitamins that help people boost their immune system naturally. And I'll put a link in the description below. It's called Immune Basics. Now, doctors believe this mucormycosis, which has an overall mortality rate of 50%, may be being triggered by the use of steroids, a life-threatening treatment for severe and critically ill COVID-19 patients. Okay, so that's a huge mortality rate, 50%. Now, steroids reduce inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronavirus. But they also reduce immunity. Okay, this is something that's important to understand too, because we can unpack all this. There's no magic pill out there, right? Whenever you take a medication, you get some benefit and you got some negative side effect. And this is what we're seeing with the steroid. So sure, it actually decreases the inflammation, but it actually reduces your immunity as well. And this is the danger of all the people who are out there taking steroids. Every time they have, oh, I got joint pain, they go to their doctor. Doctor hands them a steroid. It depletes your immune system. So, but they also reduce immunity, the steroids, and they push up your blood sugar levels in both diabetics and non-diabetic COVID-19 patients. So it's boosting your blood sugar levels up. It's thought that this drop in immunity could trigger these cases of the mucormycosis. Now, we also have to understand that not only will the drop in immunity be a big concern, but the other problem is this, is that if it's raising your blood sugar, the one thing that fungus tends to really thrive on is sugar. Think of candida, for instance. It's a very similar type of fungus in some aspects, but it will thrive in people who are eating a lot of sugar. So diabetes lowers the body's immune defenses, coronavirus exacerbates it, and then the steroid will help COVID-19, but it'll also act like a fuel to the fire. Okay, so we have to understand it's give and take here, okay? So this is why making sure that you are healthy is very important. Now, I looked up some of the numbers, okay? We have to understand that there's about 70 million people with type 2 diabetes in India. Overall, that's fairly low, okay? So we shouldn't see this go and spiral out of control. It's a low number of people who are suffering from severe blood sugar issues. And I mean, compared to the United States, where you have, you have roughly 325 million people living in the United States, and it's estimated that around 60 million are suffering from type 2 diabetes, whereas India has 1.3 billion people, and you're looking at 70 million people with type 2 diabetes. So it's highly unlikely that even with COVID and all this stuff going on over there, that they're going to see this spiral out of control, okay? And I think that's important to realize, because a lot of people have seen this on the media and they're just going nuts over it, thinking that, to me, the way that people have approached me asking me about it, I assumed that it was just killing people off in droves. And we'll get to that in just a moment. But I want to talk about real quick the symptoms that start to arise. Patients suffering from the fungal infection typically have symptoms of stuffy and bleeding nose, swelling of the eye, and pain in the eye, drooping of the eyelid, and blurred and finally loss of vision. There could be black patches in the skin and around the nose. Now, the doctors go on to say that most people are arriving too late when they have this. When they are already losing vision, the doctors have to surgically remove the eye to stop the infection from reaching the brain. So this is obviously a tough thing, because one of the things that you can't have is people just surging the hospital system because they're terrified that they have black fungus, right? That's obviously an issue, just like it was an issue in the United States where people were just surging the hospital system because every time somebody got the flu, they thought that they had COVID, and that really wasn't the case. I mean, people forgot that the flu still exists, but they were just terrified of it because of all the fear-mongering going on in the news. And the same fear-mongering I see literally happening with this black fungus issue, okay? Because in reality, when we look at this, 1.3 billion people, this article here goes on to say the rare fungal disease mucormycosis has killed more than 300 people and infected more than 12,000 in India, okay? 300 people in the realm of 1.3 billion people, it's not that much, okay? Once again, this is something that there's a lot of fear-mongering going on with. There's a lot of people who don't understand it, but overall, it's a very, very low number in terms of that many people. So they say in here, a surgeon at the hospital in France basically told people that the black fungus can infect people who have been treated with oxygen for coronavirus. And that's something that's new too, because we saw, well, it's steroids. Now we're seeing, well, as people treat in oxygen, we're going to see this. And that's where I came back to that original statement of, well, a lot of people just don't know in the beginning. The big thing is that we do know. That is a truth that will always remain a truth. I feel like I have to say this so much because there's so much nonsense out there, so much nonsense type of information that people are buying into. The thing that's important to realize is that if you have a well-functioning body and immune system, this isn't something you have to worry about. Now, when we look at this fungus or fungus in general, I'm going to talk about fungus in general because I like to look at just the common sense of things. There's a few things that help get rid of fungus, okay? And I'm not saying that I will tell you straight up, if I was in India and there was concern of me having a black fungus issue, I would be looking for the medical treatment on this. I would not be looking for the natural treatment. But one of the things that they're having in India is a big problem with the ability to have enough of the medical treatment. Okay, so here's some other things you could look to that help fight off fungus. Garlic is one of them. Coconut oil, curcumin, xylitol, aloe vera, pomegranate, and kombucha, and then probiotics. And kombucha and probiotics is really the idea of boosting healthy probiotics within the body so that it can fight off this fungus. Because this is just like people who have candida. What happens is that they end up just having a very poor microbiome. As a result of that, what happens is that they can't fight off fungus. Well, it just so happens to be that people with high blood pressure and diabetes and all these different things, they also tend to have a very unhealthy gut and very unhealthy microbiome. So here's some of the things that you can look to help naturally get rid of fungus in the body. And overall, it's important to realize, like I said, I don't see this coming to the United States or just traveling across the world, creating huge issues. I see this as a very regional issue. Overall, when you're looking at the realm of, over 1 billion people, I think that the number of cases and the number of deaths are extremely small. Yes, terrifying. Black fungus is terrifying when you start looking at people getting infected and having to just get parts of their body removed as a result of it. But it's worth noting that I don't see this being a huge issue that many people need to be afraid of. Like I said, I think when you look at all of these media sources anymore, fear-mongering is what sells ads because it gets views and that sells ads, that makes money. There's no reason to be terrified over this, in my humble opinion. And then one of the things I also want to have you do is check out some of the other videos on the channel. I think you'll like this one right over here.